A typical Western diet is characterized by reliance on animal products, refined carbohydrates, and unhealthy fats like processed vegetable oils, and this can promote an inflammatory environment. A pro-inflammatory diet has been associated with an increase of breast cancer risk and a higher risk of death from breast cancer. The American Cancer Society and the American Society of Clinical Oncology recommend women who are diagnosed with breast cancer drink no more than one alcoholic beverage daily and eat a diet that emphasizes unprocessed vegetables, fruits, whole grains, legumes, and fish. A diet emphasizing unprocessed plant-based foods has been associated with reduced breast cancer risk in several studies. This dietary strategy will naturally provide plenty of cancer-fighting phytochemicals. Phytochemicals are specialized compounds found in plants, and they have health benefits, including anti-cancer effects. A diet that emphasizes unprocessed plant-based foods will also be low in saturated fat, a high intake of which has been correlated with increased breast cancer risk and worse outcomes for women. When meat is cooked at high temperatures with dry heat, cancer-causing compounds such as polycyclic aromatic hydrocarbons are formed, and consumption of high amounts of grilled, barbecued, or smoked meat has been associated with increased breast cancer risk, especially among the women who consume few fruits and vegetables. Furthermore, a recent study found that meat that was cooked at high temperatures, like grilled, can decrease the chance of survival after the diagnosis with breast cancer. In that study, women who consumed the grilled meat after diagnosis were 31% more likely to die during the study's average 17-year follow-up period. The association between soy and breast cancer is very controversial. The controversy arises because constituents in soy, particularly the isoflavones, can exert estrogen-like activity in the body. When researchers first discovered the property of soy, concern arose that the soy might promote the growth of estrogen-sensitive breast cancers. Indeed, in some animal models, it suggested the isoflavones stimulate the growth of implanted breast tumors. However, the metabolism of soy isoflavone varies across the species, so findings from animal models on the effects of the isoflavone supplementation might not be applicable to humans. Moreover, considerable epidemiological and clinical data has found that soy food consumption is associated with lower breast cancer risk and better outcomes after diagnosis. Several large cohort studies found a diet rich in soy is associated with a reduced risk of breast cancer recurrence. In one study, Chinese women who ate at least 15 grams of dietary soy protein per day were 32% less likely to have breast cancer recurrence. A second study enrolled 9,514 Chinese and American women who were previously diagnosed with breast cancer. Women from either country with at least 10 milligrams of isoflavones from soy-based food in their diet every day had a 25% lower risk of recurrence. A meta-analysis that combined the data from many studies also found including soy food in the diet after a breast cancer diagnosis significantly improved the chance of survival, and it reduced the risk of recurrence. The effect appeared to be the strongest among post-menopausal women, women with estrogen receptor negative tumours, and women with tumours positive for both estrogen and progesterone receptors. It's worth noting that some conventional physicians would advise against consuming soy because not enough data is available from which to draw the unequivocal conclusion. Aside from the importance of drinking plenty of water daily, other beverage choices are also important. As mentioned previously, women who are concerned with breast cancer should drink no more than a single alcoholic beverage per day. But other considerations related to beverage choice might influence the breast health as well. For instance, coffee contains several compounds such as polyphenols like chlorogenic acid and diterpenes, and these might prevent or fight the breast cancer. Studies suggest drinking 2 to 4 cups of coffee per day is associated with a reduced breast cancer risk. Also, in a large study with almost 1 million women, A 2-cup per day increase of coffee consumption was associated with a small reduction in the risk of dying from breast cancer. Green tea is another good choice. Like coffee, it contains health-promoting polyphenols, the most famous of which is epigallocatechin gallate, or EGCG. The green tea is a rich source of the EGCG, and 12 months of green tea extract supplementation has been shown to reduce breast density in younger women. Many lab studies have shown that tea constituents can kill or slow the growth of breast cancer cells, inhibit their metastases, and reduce their ability to recruit new blood vessels to supply the blood and nutrients to the metastatic tumours. Also, a number of observational studies has associated green tea consumption with reduced breast cancer risk, and several clinical trials have shown that green tea supplementation reduces biomarkers of breast cancer progression. Maintaining a healthy weight goes hand in hand with a healthy diet, and studies have shown that losing weight reduces the breast cancer risk. In a huge meta-analysis of data on over 4 million subjects from 139 studies, weight loss was associated with an 18% relative reduction in breast cancer risk. The same large analysis also found exercise, which is often part of a weight loss program, led to a 22% relative risk reduction. Other studies suggest physical activity can help to alleviate some of the side effects of conventional cancer therapy. For instance, 16 weeks of resistance and high-intensity interval training reduce cancer-related fatigue and symptom burden in breast cancer patients who are being treated with chemotherapy. Another study found that exercise 1 day before chemotherapy of doxorubicin improved the mood, and it reduced musculoskeletal side effects of the treatment. The American Cancer Society recommends that adults get 150 minutes of moderate intensity physical exercise, such as walking or leisurely cycling, or 75 minutes of vigorous physical activity, like running or swimming, each week. Ideally, this activity should be spread throughout the week rather than lumped together. Receiving a cancer diagnosis and progressing through the treatment can be emotionally stressful, so it's important to not neglect the mental health during this time. Maintaining a positive outlook and emotional well-being throughout the process is important, but it's often an underemphasized aspect of cancer care. Ongoing stress after breast cancer diagnosis has been shown to predict the bothersome physical symptoms and lower quality of life. The American Cancer Society recommends that patients include caregivers and family members in the consultations with the medical team. This informed support network can help to support critical treatment decisions and share the burden with the patient. Meditation, mindfulness programs, peer counseling, and other tools can help to reduce stress, anxiety, and depression, and improve sleep and quality of life. Green tea and its components have been associated with numerous health benefits. Consumption of green tea might improve the outcomes after breast cancer diagnosis. About 500 Chinese women with triple-negative breast cancer were interviewed about their tea consumption. The risk of the breast cancer recurrence was 46% lower among the women who drank the tea regularly during the 5 years after diagnosis than the women who didn't drink any tea. The vast majority of tea drinkers in the study drank green tea. An early study found the consumption of at least 3 cups of green tea per day dramatically reduced the risk of the recurrence of the breast cancer, but only for the women who were diagnosed with early-stage disease. Data from these observational studies is encouraging, and randomized control trials are now testing whether adding the green tea to the diet can improve survival. An exploratory dose escalation study found 600 milligrams of green tea extract twice a day was well tolerated by women with a history of stage 1 to 3 breast cancer. A subsequent study using blood collected during the dose escalation study found the extract reduced levels of hepatocyte growth factor and vascular endothelial growth factor, 2 proteins that play a role in tumor growth. Another study took a different approach. The women with early-stage breast cancer who were waiting for surgery took either green tea extract at 2,175 milligrams, containing about 940 milligrams EGCG per day, roughly equivalent to 8 to 10 cups of green tea, or they received no green tea for an average of 35 days prior to surgery. The women in the green tea extract group had reduced levels of proliferation markers in both benign and malignant cells from specimens obtained during surgery compared with the no tea group. Lastly, the green tea might have additional benefits for breast cancer patients being treated with radiation therapy. In one study, women with breast cancer undergoing radiotherapy and taking 400 milligram capsules 3 times per day for a total 1200 milligram dose of the EGCG for 2 to 8 weeks had several noticeable changes in growth factors and other growth-related markers in their blood. When the serum from the patients was applied to the human breast cancer cells in the lab, the cells stopped growing and they began to die. Other studies have found that the EGCG containing topical formula helps to prevent the progression of radiation-induced dermatitis when applied to the skin of breast cancer patients undergoing radiation therapy. Flaxseed is a source of healthy fiber, omega-3 polyunsaturated fatty acids and phytoestrogens called lignans. In lab studies, the lignans have anti-cancer properties. In a Canadian observational study, eating flax or flax bread at least weekly was associated with a reduced risk of breast cancer. Eating flaxseed might also be beneficial after a breast cancer diagnosis. One study followed over 1,000 women with breast cancer for several years. Postmenopausal women who ate the most lignans were significantly more likely to have survived than those eating the least. Lignans are converted in the gut into enterolignans, such as enterolactone, and one study estimated the enterolactone intake among 2,653 German postmenopausal women prior to breast cancer diagnosis, who were then followed for about 6 years. Among those with the highest dietary enterolactone intake, the overall death rate was 40% lower than those with the lowest enterolactone intake. Smaller studies are beginning to address whether supplemental flaxseed can fight cancer. In a randomized clinical trial, women who were newly diagnosed with breast cancer ate either a flaxseed muffin at 25 grams of flaxseed or a placebo every day for approximately 1 month before the surgery. Levels of the proliferation decreased and the cell death increased in the tumours for those who ate the flaxseed muffin, but not for the control group. A second study evaluated seco-isolaric ericinol, which is a plant lignan that's converted into enterolactone in the gut. Among the 45 women with benign breast hyperlipidemia, supplementation with 50 milligrams of this per day increased the level of enterolactone in the blood approximately 9-fold, and it decreased cellular proliferation in the affected breast tissue. For more on breast cancer, herbs, supplements, or natural treatment plans, check out my website.